What if something sitting in your kitchen cabinet right now, something you probably already own, something that costs less than $4, has been shown to support the very biological systems that determine whether a man over 60 wakes up with morning confidence, sustains energy through the day, and maintains the kind of vascular health that most men don't even think about until something goes wrong? I know how that sounds. I'm a urologist. I spent years dismissing apple cider vinegar as a wellness trend for people who didn't trust medicine. And then I started looking at the actual research, not the blog posts, not the social media claims, the peer-reviewed studies examining what acetic acid, the active compound in apple cider vinegar, does inside the human body at a cellular and vascular level. What I found changed how I counsel men over 60 in my practice, and today I'm going to share all of it with you. Here is the myth I need to address before we go any further. Most men think that erectile decline, fatigue, and the slow erosion of physical confidence after 60 are fundamentally hormonal problems, testosterone problems, and that the only real solutions are pharmaceutical. If your testosterone is low, you get a prescription. If the plumbing isn't working, you get a pill. The idea that metabolic health, blood sugar regulation, vascular inflammation, and gut function could be central drivers of sexual decline, and that a simple, inexpensive compound could meaningfully support all four simultaneously, that idea doesn't fit the model most men have been given. But that model is incomplete. And the men who understand what I'm about to explain have a significant advantage over the men who are still waiting for a prescription to solve a problem that was never purely hormonal to begin with. I'm Dr. Mariana, a board-certified urologist and men's health specialist with over 14 years of clinical experience. I work with men in their 60s and 70s every week, men who came in convinced their best years were behind them and left with a plan that actually addressed the root mechanisms driving their decline. This channel exists because every man deserves that conversation, not just the ones who walk through my clinic door. If you're new here, welcome to this community of wise, health-forward men and women who take their vitality seriously. Subscribe now and hit the like button. We publish every week, and what's coming next in this series builds directly on today. Drop a comment right now and tell me where in the world you're watching from. I read every single one, and I mean that. Let's go through all 10. Stay until the end because number 7 and number 9 are the ones most men have never heard explained, and they may be the most relevant to exactly what you're dealing with. Number 1. Blood sugar stabilization, and why this is the hidden engine of erectile decline in men over 60. Here is a connection that is underappreciated even within medicine. Blood sugar dysregulation is one of the most powerful suppressors of erectile function in older men, and it operates silently for years before anyone gets a diabetes diagnosis. The mechanism works like this. When blood sugar spikes after a meal, the body releases insulin to bring it down. In men over 60, this insulin response is frequently impaired. The cells have become less sensitive, the spikes are higher, the crashes are harder, and the chronic low-grade inflammation that accompanies this cycle quietly damages the endothelial cells lining blood vessels throughout the body, including the vessels that determine erectile response. Acetic acid, the active compound in apple cider vinegar, has been shown in multiple clinical trials to reduce post-meal blood glucose spikes by 20 to 35%. The mechanism is elegant. Acetic acid inhibits the enzymes that break down complex carbohydrates in the digestive tract, slowing glucose absorption and giving the body time to manage the incoming sugar without the sharp spike and crash cycle. Think of it like putting a governor on an engine. The power is still there, but it's delivered smoothly instead of in surges that damage the machinery over time. For men over 60 whose vascular health has been taking this invisible daily beating for years, even partial correction of post-meal glucose spikes represents meaningful protection of the endothelial tissue that morning confidence depends on. Number 2. Nitric oxide protection. We have talked about nitric oxide in previous videos on this channel, and I will keep coming back to it because it is that central to everything we discuss. Nitric oxide is the molecule that signals blood vessel walls to relax and dilate. It is the biological mechanism by which blood flows in the volumes and pressures required for a full erectile response. The factory that produces nitric oxide, the endothelial cells lining your arteries, is exquisitely sensitive to oxidative stress and inflammation. When those cells are chronically inflamed, nitric oxide production drops. Blood vessels stay partially constricted. The morning response becomes incomplete, inconsistent, and eventually absent. Apple cider vinegar has demonstrated antioxidant properties that reduce oxidative stress in endothelial tissue. It supports the preservation of endothelial nitric oxide synthase, the enzyme that produces nitric oxide, by reducing the inflammatory environment in which that enzyme operates. It is not a nitric oxide booster in the direct way that some compounds are. It is more accurate to say it protects the factory from the damage that was quietly shutting it down. For men over 60, that protection is not trivial. Number 3. Testosterone preservation through cortisol reduction. We have covered the cortisol-testosterone seesaw before. When cortisol is chronically elevated, testosterone is suppressed. What most men don't know is that chronic blood sugar dysregulation is one of the primary drivers of elevated cortisol in older men. Every significant blood glucose spike triggers a cortisol response as part of the body's stress signaling. Multiple spikes per day, every day, for years. That is a chronic cortisol load that quietly and persistently suppresses testosterone production. By smoothing post-meal glucose spikes, apple cider vinegar reduces one of the most consistent sources of cortisol stimulation in the aging male body. Less cortisol stimulation means less testosterone suppression. This is not a direct testosterone booster. It is the removal of a persistent brake that was slowing the engine. For men already on a natural testosterone decline curve, removing that brake matters. Number 4. Weight management and visceral fat reduction. Visceral fat, the fat stored deep in the abdominal cavity around internal organs, is not passive tissue. It is metabolically active. It produces estrogen. It produces inflammatory cytokines. It suppresses testosterone. And it is directly correlated with erectile dysfunction in men over 60 in ways that are dose-dependent. The more visceral fat, the worse the vascular function, the lower the testosterone, the more disrupted the hormonal environment. Apple cider vinegar has been shown in controlled trials to reduce visceral fat accumulation, not through any dramatic fat-burning mechanism, but through two pathways: appetite suppression via increased satiety signaling, and improved insulin sensitivity that reduces the fat storage cascade triggered by chronic blood sugar elevation. A Japanese study following participants over 12 weeks found meaningful reductions in body weight, BMI, and visceral fat in the group consuming apple cider vinegar daily compared to placebo. For men over 60 carrying abdominal weight they haven't been able to shift, this is a meaningful supporting mechanism. Number 5. Liver function and hormonal clearance. This is one that almost never comes up in popular health content, and I think it is critically underappreciated. The liver is responsible for metabolizing and clearing excess estrogen from the male body. In men over 60, liver function efficiency declines, and the problem is compounded by alcohol consumption, processed food, and the accumulated metabolic load of decades. When the liver is not clearing estrogen efficiently, estrogen accumulates, and elevated estrogen in men suppresses testosterone, disrupts the hormonal balance required for libido and erectile function, and contributes to exactly the symptom pattern many men over 60 are quietly experiencing. Acetic acid supports liver function by reducing hepatic fat accumulation and improving the liver's metabolic efficiency. A cleaner, more efficient liver clears estrogen more effectively. Better estrogen clearance means a more favorable testosterone to estrogen ratio. A more favorable ratio means the hormonal environment supporting vitality is restored, not through adding anything artificial, but through allowing the body's own systems to work as they were designed to. Number 6. Gut microbiome and inflammation control. The gut inflammation vascular health connection is one of the most significant emerging areas in men's health research, and it is directly relevant to erectile function in ways that would have seemed far-fetched 15 years ago, but are now well supported in the literature. The gut microbiome, the ecosystem of bacteria in your digestive system, influences systemic inflammation throughout the entire body. A disrupted microbiome produces inflammatory signals that circulate in the bloodstream, damage endothelial cells, suppress immune regulation, and contribute to the chronic low-grade inflammatory state that characterizes aging in most Western men over 60. Apple cider vinegar contains prebiotic properties, the acetic acid and the mother, which is the unfiltered bacterial culture present in raw apple cider vinegar, support beneficial bacterial populations in the gut. A healthier microbiome produces less systemic inflammation. Less systemic inflammation means healthier endothelial tissue. Healthier endothelial tissue means better nitric oxide production. You can see how these mechanisms are not isolated. They form a cascade, and apple cider vinegar touches multiple points along it. I want to stop here and ask you something directly. Of the 6 mechanisms I've covered so far, blood sugar, nitric oxide, cortisol and testosterone, visceral fat, liver function, gut health. Which one resonates most with what you think might be going on in your body? Drop it in the comments. Not because I'm asking you to self-diagnose, but because understanding which system you think is most compromised helps me understand what this community most needs to hear next. Tell me, I'm listening. Number 7. Blood pressure regulation and penile vascular health. High blood pressure is the single most common reversible driver of erectile dysfunction in men over 60, and it operates through the most direct mechanism possible. If the pressure in the system is dysregulated, the hydraulics required for a full response cannot be reliably achieved. The penis is, among other things, a vascular organ. It requires precise blood pressure dynamics to function correctly. Chronic hypertension damages the arterial walls, reduces vascular elasticity, and impairs the rapid blood flow increase that the erectile response demands. Studies have shown that regular apple cider vinegar consumption produces modest but meaningful reductions in blood pressure in hypertensive individuals, with effects attributed to its impact on renin activity, the enzyme system that regulates blood pressure, and its potassium content, which supports arterial relaxation. These are not dramatic medication level reductions, but for men whose blood pressure is in the borderline or mildly elevated range, the combination of apple cider vinegar with other lifestyle interventions can produce clinically meaningful improvement, and every point of blood pressure reduction in that range represents real vascular benefit downstream. Number 8. Cholesterol and arterial plaque. The arteries supplying blood to penile tissue are among the smallest in the body, which means they are among the first to show the effects of atherosclerotic plaque buildup. Long before a man has a cardiac event, long before a cardiologist raises a concern, the microarteries responsible for erectile function are already being compromised by the same plaque-forming process. This is why erectile dysfunction is now recognized as an early warning sign of cardiovascular disease. The plumbing in the smallest pipes fails first. Apple cider vinegar has been shown to reduce LDL cholesterol and triglycerides while supporting HDL levels in several clinical studies. The mechanism is related to acetic acid's effects on hepatic lipid metabolism. Essentially, it helps the liver process and clear lipids more efficiently, rather than allowing them to accumulate in the bloodstream. For men over 60 who have been managing borderline cholesterol for years, adding apple cider vinegar as a supporting intervention, alongside diet and where necessary medication, contributes to the arterial health that erectile function directly depends on. Number 9. Sleep quality and the overnight restoration cycle. I have spoken about this in previous videos, and I will not stop speaking about it because it remains one of the most underappreciated mechanisms in men's sexual health over 60. Morning erections happen during REM sleep. They are the body's nightly vascular maintenance cycle. They require deep, complete, uninterrupted sleep to occur. Men over 60 with blood sugar dysregulation, which we have established is common and often undiagnosed, experience a specific pattern of sleep disruption. Blood sugar drops in the early morning hours. The body releases cortisol and adrenaline to correct the drop. The man wakes at 3 or 4 a.m. with a racing mind and cannot return to sleep. This pattern is extremely common, and most men have no idea that blood sugar is the cause. By stabilizing overnight blood glucose, apple cider vinegar taken before bed reduces the frequency and severity of these nocturnal cortisol spikes. The blood sugar stays more stable through the night. The corrective hormonal cascade doesn't fire. The man stays in REM sleep. The maintenance cycle completes. The morning response is there. This is, for some men, the single most direct mechanism connecting apple cider vinegar to the symptom we're discussing today, and it is almost never explained. Number 10. Psychological confidence and the feedback loop of physical recovery. I include this not as a soft afterthought, but as a clinical reality that shapes outcomes in ways the other 9 mechanisms cannot fully account for. When a man over 60 begins to notice real changes, better sleep, more morning confidence, more energy, less abdominal weight, something shifts in how he carries himself. He makes better food choices. He exercises with more consistency. He drinks less. He sleeps with more intention. The physical improvements create behavioral momentum, and the behavioral momentum accelerates the physical improvements. This is a positive feedback loop, and it is as real and as measurable as any of the biochemical mechanisms I've described today. The reason I mention it is this. Do not underestimate the value of starting somewhere. Apple cider vinegar is not a cure. It is not a replacement for medical care, but it is a real, evidence-supported, inexpensive entry point into a cascade of improvement that compounds over time. And for men who have been feeling helpless, who have been accepting a slow decline as inevitable, starting somewhere and feeling something change is the intervention that makes everything else possible. I want to tell you about James. James was 63 when he came to see me, a quiet, methodical man, a retired accountant who approached his health the way he approached his balance sheets, looking for problems he could quantify. He came in because of fatigue, increasing abdominal weight despite no real change in diet, and what he described after a pause as mornings that had stopped working about 2 years ago. His fasting blood sugar was in the pre-diabetic range, his blood pressure was borderline, his testosterone was low normal, his sleep, by his own description, ended every night at 3:30 a.m. and never resumed. We discussed his full picture, and as part of a broader protocol, we added 1 tablespoon of raw apple cider vinegar in water before his evening meal and another before bed, among other changes. At 10 weeks, James came back with something different in his posture. He said, "I'm sleeping through to 6 a.m. now. I don't know which thing did it, but something is different." His blood sugar had moved out of the pre-diabetic range. His blood pressure had dropped 6 points. And then, almost as an aside, as though he wasn't sure whether to say it, the mornings are back. Not like I was 35, but back. He sat quietly for a moment and then said, "I thought that was just done. I didn't know the body could still respond like this." The body can still respond. That is the message I want you to leave here with today. I need to speak to the thought that may be sitting quietly in the back of your mind right now. The thought that says, "This is interesting, but the changes in my body have been going on too long." That the window for this kind of recovery has passed for me specifically. That other men might respond, but the math doesn't work out in my favor anymore. I hear this thought in my clinic regularly, from men who have been carrying resignation so long they've mistaken it for realism. And I want to say clearly and without false comfort, I have watched men in their late 60s and early 70s experience genuine, measurable recovery from interventions this simple. Not every man, not in every circumstance, and I will never promise outcomes I cannot guarantee. But the biology of vascular repair, hormonal rebalancing, and sleep restoration does not have a fixed expiration date stamped on it. The body responds when the conditions change. Your job is to change the conditions. The question is not whether recovery is possible. The evidence says it is, far more often than most men have been told. The question is whether you are going to give your body what it needs to demonstrate that to you. Here is your action summary. 1. Start with 1 tablespoon of raw, unfiltered apple cider vinegar with the mother in a full glass of water before your largest meal of the day. 2. Add a 2nd tablespoon in water 30 minutes before bed to support overnight blood sugar stability and sleep quality. 3. Always dilute. Never take apple cider vinegar undiluted, as the acidity will damage tooth enamel and the esophagus over time. Use a straw if possible and rinse with water afterward. 4. Choose raw and unfiltered with the mother. The filtered clear versions have reduced prebiotic and enzymatic content. 5. Give it 60 days of consistency before assessing full results. 6. Combine it with the vitamin D3 and ashwagandha protocols from our previous videos if you haven't already. These mechanisms stack and compound together. 7. Track your sleep quality and morning response weekly. 8. If you are on medication for blood sugar or blood pressure, consult your doctor before adding apple cider vinegar, as it may potentiate those medications' effects. Your 30-day challenge. Tonight, mix 1 tablespoon of raw apple cider vinegar in a large glass of water and drink it before dinner. Do the same before bed. For 30 days. Come back to this video and tell me what changed. I will read every comment. If this video gave you something real today, please like it. It is the single most effective way to help this information reach other men who are carrying this quietly and don't know where to look. Subscribe if you haven't already, because next week we are covering the 1 mineral that works synergistically with everything discussed today, in a way that accelerates every mechanism I've described. You do not want to miss it. And in the comments right now, I want a specific answer from you. Which of these 10 benefits are you most motivated to experience in the next 60 days? Name it, one thing, because naming it makes it real. Aging is not the end of vitality. It's an invitation to live smarter. I'll see you in the next one.